One of our awesome patients, Melissa, she's currently in longevity care. So she finished her case and she's, I don't know, 80-90% better. And she emailed and asked, how do I progress to good mornings? The good morning is one of the primary exercises we use to rehabilitate the low back when somebody has chronic pain. And it's something that people need to continue to do if they want to prevent low back pain. So it's a really relevant question, and we don't always talk about it during the case. The good morning is an exercise where you bend your knees and you just tip your back over. So you're strengthening your low back. This is putting a shear stress on your back, and you're putting tension on the sciatic nerve and also engaging the hamstrings as you stand up. So it's a very important exercise. So what do you do when you've gotten to 2 sets of 15 reps every single day and you're not using any weight? The first thing is you respect the principle of gradual progression. So people will deadlift 400 pounds, hurt their low back, we'll fix them, they'll go back to 400-pound deadlift, and then they'll hurt their back again. So we need to build up very slowly over weeks to months to get to be strong. So if we're at 2 sets of 15 reps and we've been there for a few weeks and it's symptom-free, we start with, I recommend, a 5-pound dumbbell or plate, and we hold it to our chest, and we do reps like that. We peel back from 2 sets of 15 down to like 2 sets of 5 with this, and we build up very slowly over weeks to months. So maybe we do 5 pounds for a week, then we do 10 pounds the next week, then we could go up to 15 to 20 pounds if we really need that much strength based on what we do, how young we are, or how athletic, or how much stress we need to put on our body. Then we need to also listen to the fire alarms. The fire alarms are pain. So if we're gradually progressing the stress, when we have a little bit of pain, it won't be a big deal. We'll recover fast. If we're getting treatment, then we'll just remove the adhesion and people will be good to go. But if we're not listening to the pain and we just ignore it and keep doing the exercises despite that, that's when that little fire on the stove becomes a house fire, and then our low back's completely screwed. So we're gradually progressing, and then we need to listen to the fire alarm, and then we need to be mindful of the time windows. Most people are very aware of a 24-hour time window, meaning, okay, I woke up at 8 o'clock in the morning, I hurt my low back at 5 p.m., what did I do today? 24 hours. What I'm suggesting is that's good, but now we need to expand our awareness of different time windows. A 3-day, 72-hour window, a 1-week window, a 1-month window, and be asking ourselves pretty constantly, I almost do this every day, what have I been doing the past 3 days? What have I been doing stress-wise the past week? What have I been doing stress-wise on my body the past month? And to assess how my body feels, because then I can gauge how much load or activity that I want to be doing today, tomorrow, and the next week, and the next month. If we're only aware of that 24 hours, we're going to be missing the boat. We'll ignore the fact that we just did 6 days of workouts before today, and that's why our low back's hurting. So we just need to be much more aware. So Melissa, you can progress up to I'd say 15 to 20 pounds with a plate across your chest or a dumbbell, and very slowly, respecting gradual progression, listening to the fire alarm, your pain, and being mindful of the different windows and how your symptoms feel. And if you do this, in a couple months, you're going to be happy with the strength improvements you have, and you're also going to be bulletproofing your low back 20, 30, 40 years into the future. I hope that's helpful. Let us know. I love you. Bye, Melissa.